Hey there, this is Dr. Evan Osar, founder of Fitness Education Seminars and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Welcome to this edition of Fitness Insider, where we're going to discuss the role of controlling the femoral head within the acetabulum during hip extension. We know that the glutes are so important to providing hip extension, but just as importantly, the glutes are responsible for maintaining hip centration, or maintaining that femoral head within the acetabulum. So we want to think about the femoral head being centered and aligned within the acetabulum. So even when we perform hip extension, so imagine I'm facing this direction and I'm going into a hip extension type pattern, we want the femoral head to remain centrated and centered and aligned within the acetabulum, not change position. What happens to a lot of our clients that have hip dysfunction is they'll squeeze those glutes, and what happens is they drive that femoral head forward within the acetabulum. That creates impingement, that creates wear and tear, and a lot of that condition that we're seeing now is FAI syndrome, or femoral acetabular impingement syndrome, because that femoral head is coming so far forward within the acetabulum. So what we want to do is make sure we encourage proper motion of the hip and centration of the femoral head during common hip patterns. So let me show you what I mean by that. So let's take the split squat, for example. We can take a split squat, and what we want to do is teach our clients to use their glutes, but we want to make sure they centrate the femoral head as they're performing the split squat position. So what I have the client do oftentimes is they're going to come down to the split squat position. I want them to release through the posterior hip. I want them to relax the posterior hip so that femoral head can glide back into the acetabulum. I want to make sure that the front of the hip stays soft. So I want to palpate and make sure they palpate and are able to feel that the hip flexors stay soft. And then you come out of that position and into the extended position without clenching and driving that femoral head forward. So if you watch my fingers, when I clench my glutes, it drives my femoral head forward in the acetabulum. That's what's creating that femoral acetabular impingement. So we want to make sure we sit back, relax the front of the hip, come up into hip extension with the glute contracted, but not over clenched. So again, we do a couple repetitions, teaching the client how to maintain glute activation. The next progression is now we're going to teach them how to go into the split squat and then step up into that position. So they sit back in the hip, and they step up to come into the standing upright position. So again, using that glute a little more dynamically. And the final progression is, then we'll teach a client to go split squat, and they step all the way forward, and now their hip's coming more into hip extension, but again, not over clenching where they're changing the alignment of the femur within the acetabulum. So sit back in the hip, and then step forward into, so they're going into hip extension, getting some glute activation, but the hip stays centered. And that's why it's so important to have your client either palpate on themselves, or if you have permission or you're a manual therapist and you do palpation, make sure they're not over clenching the glute, that they're using the glute appropriately during these progressions, whether they're doing squats, split squats, lunges, step ups, bridges, things like that. We want to make sure that the femoral head stays centrated within the acetabulum through all the functional patterns, and then the glutes start to do the job that they're supposed to do: centrate and produce hip extension. Get us up out of these load positions, lower load positions. This is Dr. Evan Osar. I hope this video has served you and helped you become an expert that your clients need, want, and will pay for. We'll catch you next time.